Friends, my deep appreciations to you for your patience that you can listen to me right now because I'm last speaker today. I also congratulate all of you, and Adriana and Isco3, for so big job we did together about Madrid Declaration. I believe it's the most important document for all of us to implement this technology in medicine, stomatology, veterinary, everywhere in the world. It's an argument to discuss with local authorities. It's very important. I'm proud to be part of this great team. And now about my presentation. I'm surgeon. I'm professor of National Medical University in Kyiv, and we did all this presentation together with my partner and my wife, Tatiana Chernyshova. Now, due to war, she is living in Poland and continue working with Ozone and implement Ozone in Poland. I still work in Ukraine and treat our wounded and teach our not only surgeons, but first of all, the physicians to treat with wounds. So, let's begin. Just.
Él está en primera línea de guerra en Ucrania, lo sepan, ¿no? La esposa está en Polonia, basada en Polonia, pero él está based en Ucrania, en el terreno. Какого города?
Тору.
Где это находится?
It's northern from Warsaw. From Warsaw.
Está la ciudad donde él trabaja está muy cerca de Varsovia, de Polonia, ¿no? Pero en terreno ucraniano.
So, thank you. I just few minutes of emotions from you. Many of people in the world.
It's not, that's why it's over. You gotta move it.
So, over there.
Yeah, you gotta do it here.
That's pictures made from my hometown, Bucha, this neighborhood of Kyiv, capital of Ukraine. 3 years ago, we were woke up with explosions, with full-scale bombing, by missiles, by bombs, by tanks, and we, with our kids, seated in vegetable underground with 14 people on 4 square meters for 10 days, without electricity, without gas, without connection, and only after this, we could escape from our butcher, and this is why my wife is still in Poland, and I back to Ukraine to treat wounded people and to teach doctors how to do it. Maybe later you'll see here when missiles destroy our clinic, Ozone clinic in the center of the Kyiv. So this still is in Ukraine. Today my phone received 4 air alerts from Kyiv. Every night we have at least 100 drones attack our Ukraine. About it, few times we have even 500 drones a day attack our Kyiv. And just a few seconds, please wait. I will show you how missile destroy our planet. Many people in the world try not to think about war, trying to forget about war, but it's still continuing in my home. This thermobaric explosion. And look here, the missile, this is just around my clinic. Okay, that's enough. Yeah. This is one of famous pictures in the streets of my town, about half a kilometer from my home. And now about ozone. My presentation is not about deep science, because it's very difficult to make deep science now during war. It's about more practical things. I just want to remind you that ozone could not be only produced by corona discharge. It could be produced by ultraviolet, by plasma, energetic plasma, and by electrolysis. During COVID, we started to experiment with electrolytic ozone and found it's very, very effective. Ozone, when we receive it not from oxygen but from water, we have ozone already dissoluted in water and molecular hydrogen, and very, very small traces of hydrogen peroxide. Why it became so good? Because because except of normal ozonator, we invented so small things for pockets. It could be charged from Type C. It could be filled with normal drinking water. Just a minute.
Ellos tienen que imaginarse, cómo diablos resolver en el terreno, lo que les decía, uno tiene que ser muy imaginativo para poder copar con las situaciones. No puede andar con el generador debajo del brazo en plena guerra.
And activated, just pressing the button 3 seconds. In 30 seconds, we have 1 ppm of ozone in water. When we make double press, we have 60 seconds and 2.4 ppm ozone in water. Absolutely without gas. Absolutely without smell. No, just a little smell. I can use it for drinking because we can propose it for by Madrid Declaration 2.5 for drinking from helicobacter. We can use it for cosmetics. We can use it for wounds and for different other things. In COVID, we used with nasal spray for disinfection of hands, disinfection of mouth, disinfection of eyes. So then it's cheaper, but the action is the same like a normal medical ozone from gas dissoluted by barbotage. Anyway, ozone destroys the membranes of bacteria. It damages the viruses by itself, it damages the fungi, and we don't know resistance to ozone of no microbes. These ones, we finished to experiment with with electrolytic ozone just before the full-scale war, and everything we bought for us, for commercial, we donated to hospitals, we donated to military medicals for use in the front, for use everywhere. Now, the smaller and the previous model of bigger one, but I could not took it with me because of weight. Also, we have other things that could be used stationary for dentistry, for sterilization of water channels in equipment, and also it could be used for washing machines. And this machine doesn't need no detergents, no conditioners, no special rinsing before and after, and ozone disinfect, deodorate, and wash. If it will be developed, so we can avoid many problems for allergics, for atopic dermatitis, for also now it's trend to use it for trimming and for hair dressing, for rinsing, because it kills dandruff. So, later. Just another video. I'll try to, yeah, okay. Just small video for measurement, because maybe I'm liar. So just normal photochemical detection, normal type photo.
You are testing.
Yeah. And just look what I did, just 50 seconds. Okay. 2.4. Exactly. ppm in 60 seconds. Okay. Later. So we can say that ozone is so powerful, like ultraviolet, like hypochlorite, like alcohol, but it works much more quick. So it's maybe more effective than others. But after destroying the germs, ozone receives no residual, gives no residuals. So it's much more safe. Then, next video, it's here. We, in everyday work, we could not make a lot of microbiology tests. So here we use normal chemiluminescence ATP test. ATP is present only in the live bacteria. So look here, normal sample in connection with special reagents, it gives light proportional to number of bacteria in solution. So the same thing, my favorite, after the, look, the same sample, we had about 2,500 units, yeah, on measurement, if you remember. 2.4, yeah, it's very dirty. But now, the same procedure. And look, I can say that one colony formed quantity of bacteria is about 50. Look here, one. What will we have? it's almost sterile. So you can use it not only for sterilization, but even for using it everywhere for cleaning of surfaces, for mucosa, for eyes, for nose, for skin, for anywhere you want. So, about toxicity, I think you know everything about this. The ozone has no toxicity, has no irritation, no micronuclear effects. And about the Madrid Declaration, we recommend in the previous edition and this edition as well for external use up to 20 ppm, and for digestion up to 2.5 ppm. Here we have 2.5. So this test about microbiology. Just look, 2.9 after dot. It's very effective. And how the speed of disinfection. We don't need bigger concentration because it works even in small concentration. So I think in future we will decrease the level of ozone to avoid toxicity and any FDA limitations because we have such microbiology. And much bigger microbiology, this test made by Canadian company Tersano, and it's the most expensive and biggest test for electrolytic ozone in 1 ppm. Look here. It's 3/9 after dot. Look for the microbiology. Candida, Escherichia, Aspergillus, Staphylococcus, also methicillin resistance Staphylococcus. So everywhere we can use the water stabilized aqua ozone, salt. It's continuation about viruses, corona, and syncytial respiratory virus, canine parvovirus, so it's mainly used in veterinary as well. And look here, also pathogens, hepatitis, rotavirus, enteric virus, and Clostridiums. Look, 1.5 ppm. And what we do with wounds. First of all, doesn't matter what stage of wound is it now. We use ozonated water for rinsing. We have very, very quick decrease of inflammation and infection. But especially for bacterial films, we found that we need at least 5 minutes of exposure because it needs some time to destroy the biofilm. So after this, we apply oil, ozonated oil. Why? Because ozonated oil is much lower efficiency than water, but it works longer. Even after 2 or 3 days after we change the dressings on, for example, NPVT, WAC therapy, we use a smell of ozone. It's still working. We didn't have no one anaerobic infection in multi-resistant patients after WAC, after NPVT with ozonated oil. The same in veterinary. It's much easier to convince veterinarians to use ozone than to convince doctors. That's why they ask us for solutions in many cases where they could not use no medicine. It's one of such cases. And In field conditions, we recommend to combine the ozone. We could not use gas in field hospital. It's very difficult because it needs oxygen, it needs equipment, it needs some ventilation. It's unable. But here, me and my friends in field hospital, we do the burn with laser, ozone in water, and ozone in oil. So, why we should need widely stabilized aqua ozone? Because it's safe. We have no gas fraction to detox, to use destructors to ventilate. We have it already ready. Second, it's really very efficient. You saw the macrobiology. With my friends from Thermopylae Medical University, Department of Microbiology, now we have a lot of publication about the use it for inactivating of flora in water, in lake, anywhere in a dirt. We can use electrolytic ozonator for use it in a field conditions. So it could be used in any stage for prevention, for treatment, for rehabilitation, and for home care because it's cheap.
And sport.
Yeah, sport, yeah. For example, this is 100 euro for end user. It's not thousands. 100. 100 just. And if you use for your clinic, it should be quite profitable. Then, what we do for this? We make biosafety instruction for home. We make a lot of lectures, seminars, microbiological studies, printed materials, and we teach people for healthy home, for healthy treatment, and for use it everywhere, especially in schools, because it's absolutely non-toxic, in senior houses, and everywhere. And later, just few clinical cases from us. Now we have only from my team. Okay, from my team, we have 320 patients treated with ozone, military patients. So shortly, I show you. Look, this. How we use it. It's a montage of NPVT, VAC therapy. First of all, we rinse it with ozone water. Then we apply oil and we apply VAC equipment. So it's different stages of the same patient before autodermoplastic. This patient. Look, next one. This is a very, very difficult case. 4 months of stagnation with no results, with absolutely resistance for all available antibiotics. Only after one application of ozone and laser, his wife, it's a soldier, called me from Vienna and say me thank you because 4 months he cried to telephone because it was very, very deep pain. But after only one dressing with ozone, he could speak with her about 2 hours without no crying. Look, the same thing, and later. And most massive explosive wounds. total resistance. Actinibacter baumannii. And this guys, after what? After dermoplasty, and on the finish of our treatment. This is a comparison of different stages of treatment. Next, also mind blast injury. It's here. Then oil. This is another fluoride with PCL and after dermoplasty. The same total resistance and after dermoplasty. No. Next, probably the same thing. And this new for us method we use here's videos. Okay, this one. We use a full flush with electrolytic ozonated water, and it gives us possibility to treat a blind channels without drainage. It's very good. This patient, little bit later. Yeah, just a minute. Just a few cases. Once more, it's a spinal patient after car crash. Work therapy with ozone, and the result, smile on the back. And this case of my wife, of Tatiana, fulminant acne. This case will be published in Springer Blog soon. It's already recensed. After all kinds of retinoids, steroids, antibiotics, she was hospitalized twice. First with septic shock, second with toxic cardiopathy, and after ozone therapy. Only rinsing with this and oil. That's all. In 1 month. Yes. Now she is treating only post-acne. She is happy with ozone and use it daily for everything. And now about the equipment. When we got damage of Kakhovka Dam, Russians ruined it and think about 80 villages. So we used ozone in such form factor that could be used with power bank for sterilization of drinking water and rinsing of surfaces, wounds, and everything. It's good for working with. By its recommendation, it's for just of half a liter. What we use is for 5 liters, and in 5 minutes we restore water from the green and smelly to normal, even with use of solar panels. And now we have a new equipment, bigger, for half a bucket, for 4 liters. This one. It's also cheap. It's about 120 euro. And this company, Sion, is one of the best our partners because we collaborate with different manufacturers this developed this big for 1 liter for spraying of big surfaces. And one of the best, probably the best thing is a dental irrigator with ozone generator inside. May I have 1 more minute, 2 minutes. This one, it can be filled with water, connect the tip, and you can use for wounds, for drinking from Helicobacter because it's 200 milliliters, for dental care, for home dental care, for rinsing nose, and everything you want. But the main thing, we should not wait even 30 seconds because it works on demand. When you press button, you have ozone in the flow just immediately. So, and difference between normal irrigators, and this smoke we give to soldiers like a part of their personal personal use. So conclusions: electrolytic aqueous ozone with hydrogen is cheap, is mobile, autonomic, efficient, and extremely good for disaster conditions, not only war. Second, the best way is to combine systemic ozone therapy with local ozone therapy. But in disaster conditions, sometimes it's very difficult to find ozone generator and bottles with oxygen everywhere. This is possible. Then, combination of local use gas is the best because of deepest penetration and quick action. But rinsing is immediate, is absolutely important for ruin the biofilm. And oil on the end will continue the work of ozone for a few days. So we should combine all the ways. Then, it's the best we found for the prophylaxis of anaerobic infection in such patients, especially for WAC therapy. And the combination of these ozone methods can give us drivers of antibiotic resistance. So in one of our newest to be published articles, we propose to name the ozone therapy like pre-antibiotic therapy in resistance cases. Pre-antibiotic therapy. And then it could be the best combination with other regenerative methods. We recommend low-level laser and growth factors like PRP or mesenchymal or something else. So, I just few words about who did everything. Alexander Bild, the ingenious reconstructive surgeon from Chernivtsi. We worked with him more than 15 years. Mika Saarinen, it's the chief of Finnish Association of Ozone Therapy, who produced for us ozonated oil, and personal Adriana Schwartz, who also donated oils for treatment of these patients. Department of Microbiology of my alma mater, of Ternopil Medical University, and my wife. Muchas gracias.